you? Welcome. Today I'm going to be talking about what you might get if you're going to get a bunionectomy, an osteotomy, maybe even a foot surgery of some sort, ankle, leg. But the first thing that I'm going to talk about is this right here. It's the Lumix Modern overbed table with wheels. It's 28 to 41 inches in adjustable height. I'm going to show you how that works. So I'm sitting in a chair right now. So this goes all the way up. So if I stand, this is me standing. Kind of went out of frame there. And this is all the way down. So if you see, I think you can see this lever on this side over here. It's really easy to do. All you do, it's an easy lift, and then you push down. It's a composite table. It offers modern and contemporary look, and it's more durable than your grain tops. It does, once again, have the automatic height adjustment with the touch of a button. It raises and lowers, and it stops. And so the stop from here all the way to the top is about 13 inches. So if you're in bed, this easily goes over your bed. It's got a large table. It's 15 by 28, and once again, it is a composite plastic, so that's easy for cleaning. And it also supports up to 50 pounds, and it's, like I said, it's perfect for eating. Actually, even if after your surgery and once you're healed, it's great. I've been able to use a laptop in the bedroom. It's the Osser Form Fit Walker boot with air. It's a medical grade immobilization boot. Now, I didn't get this on my own. This is the one that actually my doctor picked. And once again, I'm not a doctor, simply a patient. So make sure that you check in with your doctor. And I'm sure they've got some sort of boot. But if you have other things that happen and you need to immobilize your foot, this might be a great option. Once again, always check with your medical professional. And so this is an open toe walker boot. And once again, it does have air. So they make different types. They make one with and one without. So basically, I had the bunionectomy and I had to keep it immobile for a few months. And this I had to actually sleep with as well. So it is a hard boot. It does rock. And I actually called the company because my doctor's office didn't inform me this. But, so this straps, so if you can see, it straps in quite a few places. I hope you can see this here. So it straps here down on the toe. Once again, it is an open toe. Down here, oh, and I want to show you these. They give you these for comfort as well. So I was putting mine right here because I just happen to be a little sensitive there. And I used that pad right there. That's how I used mine, but you may find something else. This comes in and out. I'm not going to pull it out right now, but I want to show you how this straps up. So there's 3 straps. Whoops. Maybe I should have shown you on my foot. I don't know which would have been easier. So I'm new to the Amazon Live, so please follow me and watch me grow here. All right, so there's the 3rd one. And then this button here is where the air is. So basically you turn it one direction and you fill it up. Now this is a compression. So on the inside, I can feel this. It's blowing up with air. So you know how compression, so it makes it tighter around your leg. And then if at any point you need it looser, you simply turn this the opposite way and it deflates. So it's got everything. It's got a high top. They have also a low top version, and it's available in 5 sizes. And additional accessories such as hot cold therapy inserts, heel wedge, and more are sold separately. And they're designed and tested for a single patient use. Okay, so next I have these. These were the slippers that saved my life after my surgery. They're by a company called Bunionectomy, and I got 2 different sets. This one here is the Gemma, and it's it's a Mule Slipper. It's got a little flap right there so that you can adjust it onto your foot. It's got a rubber outsole. It's man-made, and the fabric type is 100% synthetic. Its origin is imported. The sole material is an ethylene vinyl acetate, and the outer material is a terry cloth. And I also did thing about the Bionics. This one is the Relax Slipper. This one that I'm showing here. This one actually has a crossover strap like that. And so if you're really swollen, this one actually ended up being quite good because I was really swollen in the beginning and I couldn't get into anything. So the Relax worked really great for the beginning. And then as I started healing and I could have more coverage, or maybe you just have colder feet, then get into the Gemma. But anyway, so Bionic, they have a great footbed. They also make tennis shoes. You might see my tennis shoes later. I'm wearing the Adore, and all of their shoes have a great insole, and it really is a great orthotic support, especially if you need arch support, and actually it keeps you in better alignment. So my podiatrist did suggest these. He actually sold them in his office, but once I tried some, I became an absolute fan. And this is great because it unbuttons all the way up and down, and you don't have to worry about your foot or your boot. You simply slip this on and you're good to go. And also, it's a nice dress look, so you can get away with going to check your mail in your gown. So it's a modal, the fabric. The origin, it's imported. The country of origin is China. I actually got these in 2 different colors because it's just very comfortable. And it's got the V-neck once again. And anyway, that's by Echo Hauser, and I hope you enjoy that because it's great after surgery as well. Okay, this one's pretty big. This is made by Light Ease. It's a post-surgery leg, knee, ankle elevation. It's a double wedge. So if you look at this, there's enough room for both of your legs. A lot of the wedges just give you one. I had to keep myself elevated for at least, well, I was going to say 8 hours. It wasn't 8 hours. It was basically all day up until like 4 or 6 months. So this is great for elevating your foot. And it's gray. The material is memory foam inside. So when you get it, it's folded all the way down. And then when you open it up, you think there is no way that this is going to expand into something that I can actually use. But lo and behold, just open it the night before, and if you kind of massage it, it opens up into this. And also, let's see, the dimensions, it's 16.5 by 9 height, and it's 29 inches long. So I want to show you, so if you're wearing a boot, that's what that looks like. So that's one of your feet, and then of course your other one can rest next to it. And this is terrific later if you want to watch television and just relax. So I'll give you what their description says. So let's see, I already went over that. So it's better for your blood circulation. It keeps your legs gently immobilized without worrying about rolling off, which is true because it's got the proper incline here. And it helps relieve leg, hip, muscle tension, back pain, and varicose veins as well. So it's comfy and yet firm. It's made with premium high density memory foam, and it's good for long-term use. So once again, you can watch TV with it. So it's very easy to take care of, and like I said, it's got a zipper. So if you want to wash the cover, it comes right off and you just throw it into the washing machine. So this is a must-have for a leg surgery, I must say. And so we're going to go on to the next item. And then this one, this is tool-free. That's why I bought this. This is from Vaughn Medical. And it's an adjustable swivel So this swivels, and you would wonder, why do I need a swivel seat? But let me tell you, if you only have one foot, that swivel is priceless. So I highly recommend this, and I'm going to flip it over so I can show you how this is constructed. If you can see, it didn't need any tools. Basically, you just have to screw a few things on. The instructions were really easy, and the height is adjustable. The seat diameter is 13 inches. Sorry, I should show you that. That's 13 inches. The adjustable height up and down is 13.75 inches, which is about right here, up to about 20.5, which is about to right here. So I'm somewhere right in between. It actually weighs 4 pounds, so it's really easy to move around, and the maximum user weight is 250 pounds. So once again, it rotates. Let me show you this. These are adjustable. All you do, if you can get into there and give them a good view maybe, can you see it? This, all you have to do is press in here, and this will come off. So putting it on, you simply have to just push that in, it goes right over, and then you just pick, whoops, went all the way down. I use that one right there. So mine is at a 6. So anyway, this didn't need tools. So it's important to note that everything that I'm showing you here, you didn't need tools. Even for this desktop here, no tools were needed. And so that was specifically what I was looking for. Flexi Gold ice packs. So everybody told me make sure that you need to put cold compresses onto your to bring down the inflammation. I'm sorry. And so I ended up getting this one. And it's a small company, and I actually had to call them and ask the company some questions about this. And so I didn't know if I should get 1 or 2. So as I was talking to the agent, she said, oh, you could get 2. And she reminded me why I was thinking I needed to get 2. It's because while you have 1 in your freezer, you could be using 1. So you can swap them out. So yes, of course, you can use just 1, but I found it really useful to have 2. So here we go. And this is what this looks like. So this is their directions. It says it's a proprietary gel cold pack. It stays colder for longer than competing products that use inferior bentonite formulations. This one's soft and flexible. It has an insulating layer, enhancing cold therapy. And so one thing I do want to remind you of is that anytime you use something like this, make sure that before you, let's say I was doing this arm, before you place it on you and then secure it to you, you always want to make sure that you have a protective barrier. So get some sort of a towel or something like that, and then you're going to put it on. So never put it directly onto your skin. So let me show you the 2 straps that it comes with. So it includes one 24-inch strap. That's this one. And then it also includes one 6-inch strap. And I was wondering, why in the world, these are so different? Like, what are these used for? So, like I said, I did call the company because something so simple I've never had to use before, and I just wanted to make sure I was using it correctly. So let's say this was my foot. Let's say I put a towel over it. Let's say I put it on there, and it's so flexible and adjustable, you can put it on any way you want. And you would figure that out the best. So you have your strap. So you're going to put this here with the towel. You're going to put this on. This actually sticks to this light blue right here. And of course, with all the swelling and all the all the packing, your foot's going to be pretty large. I was quite amazed at how big my foot was. So you're going to use the large one around your actual foot. And then I actually used this one. If these were my toes right here, covered with a towel, what I ended up doing was I ended up putting it at the top. And then I did it like that. And that worked out really well for me. And what's interesting is this size, once again, is a 7.5 inches by an 11.5 inches. And it didn't say anywhere that it was for feet, but I found it worked great. for my purposes. I am so happy that I got these. See, it's double sealed to prevent any linking. It's extra thick nylon exterior. It's washable and reusable. And let's see, I think that covers all of that. So I hope that was helpful too. Anyway, I'm really happy with all of these products that I ended up getting. And I'm just showing you the ones that I happened to find on Amazon that struck my interest and I thought would work for me, and all of it worked really well. So next we're going to go to the Roscoe knee scooter. So I am going to move my table out of the way. Hold this in. So this is a knee scooter. So a knee scooter, basically, if you're in a soft cast of some sort like this, your knee, this is going to go over the back end, and that's how your knee scooter is going to work. But I'll just put that to the side. And I will rest like this. I'm going to get down here so I'm in the same frame of the bike. So this one has a handbrake, which is great. And they make different types, some for exterior, some for interior. This one you can use for both, but to be quite honest, I only used it in my house. And here's a quick tip for you. Before surgery, while you still can walk, get one of these, whether it's through, when you buy it from Amazon, and then you have to mark out paths in your household to make sure that you can go through all the tracks in your house. That's what I did. I kind of made like an obstacle course, and it worked out really well, and I'm so happy that I did it, because after surgery, there's no way I would have been able to move my furniture. I would have had to call my apartment manager, and that's not in his job's description. So anyways, I would suggest that. Now you also have the option of getting a basket. Now you might think, well, I'm not going shopping, I don't need a basket. Well, you'll need it around the house. Trust me. Because if nobody's at home, your bed is in the bedroom. You can barely reach into your cupboards on one foot, so you might have to remodel your kitchen before you do this. Actually, I brought everything down that I needed. And you're going to want to put things in here to take to other rooms, because you're holding onto this and you're tired and fatigued, so get the basket. I think it costs, just a fraction more money, and it's worth it to get it. And so let's see. That's that. And on this one in particular, if you can look down at this, I started doing it. Down here, it has a joint, and this will fold up easily. So if you take the seat off, this will go all the way down and it'll fold up, and it's easy for packing. So that is that. I'm going to put this back together. And that's it, everybody. Uh-oh, this is usually so easy. There it goes. That's it. I hope this was helpful. Please follow me, and I'll see you soon. Take care now. Bye-bye.